Hello, and thank you for tuning in to the training on new mobile app innovations for home health clinicians. I'm Heather Hafford, a nurse and a market specialist for the Axxess Care solution. Today, we will look at some of our home health and Axxess Care mobile features. On the agenda coming up for today, we have our Axxess Home Health and Axxess Care mobile feature updates, as well as we'll be sharing our upcoming new releases for upcoming mobile feature innovations, and we will share some support and resources if you have any questions or concerns. On the Axxess Home Health mobile app, which allows clinicians to streamline documentation and document EVV at the point of care, we'll be going over our new features. Our first new feature is editing patient information, which allows clinicians to update demographics at the point of care for immediate access to patient information for all of clinical team members. Our second new feature is the Oasis Audit and Signature, which allows clinicians to complete or submit on mobile application Oasis documentation. Clinicians no longer have to log into a desktop after visits or complete Oasis. The third new feature is the Oasis Scrubber. This gives clinicians the ability to rethink discrepancies and improve patient outcomes, address avoidable events, improve compliance, and other benefits. The last feature we'll be going over is communication templates. These templates have been added to communication organizational needs. On the Axxess Care mobile app, which is an easy way for clinicians to find nearby surrounding visits and earn more, the new features we'll be going over are the driver's license upload and the search posted visits bar. The driver's license upload was mandated by many accrediting agencies such as Joint Commission and CHAP, as well as some states. So Axxess Care has put it as a non-mandatory upload into its app. The search posted visits was implemented to allow clinicians the ability to search by many different filters that are relevant to the types of visits that they are looking for. All right, we are going to dive into the mobile application. Currently, I am in the Home Health mobile app under my patient Grant Augusta. I am in a visit for an Oasis D1 other follow-up. And if you will notice, the first thing that we went over for the new feature was the editing patient information. If you will go to the visit note, it brings you into the visit. Under demographics, you will see a blue bar highlighted that says edit patient info. You'll click this. At the point of care, you can now edit and improve or add, delete, whatever the case may be, the patient information. All red asterisks must be entered, and you can save and exit or you complete all. Once this information is saved or completed, the agency will have updated information on the patient at the point of care. We're going to save and exit. Click done. Our second update was the Oasis audit and signature. Now I've already pre-populated and completed this Oasis so we can run this check for errors. And what the check for errors does is it really checks for any fatal errors or any inconsistencies, any flags or warnings. I have purposely left fatal errors on this Oasis so these can be seen. This will tell you where the fatal error is at. It will tell you what is causing the fatal error and what needs to be done in order to address these errors. Once these errors are completed, if you will notice at the top of the screen, it says you have 5 errors and 0 warnings. As these errors are completed, the number will decrease until you have 0 errors and 0 warnings. You can now, after the errors are done, you can now run the Oasis Scrubber. And if you hit Oasis Scrubber, you will notice that this pre-populates in a PDF format, which is printable. The Oasis Scrubber will give the clinician an overview of all of the inconsistencies, the fatal audits, and the flags that are in the Oasis assessment. This will then give them a chance to rethink the discrepancies, improve patient outcomes, and address avoidable events during their documentation and be able to do those all at the point of care prior to submitting their Oasis. Once these have been addressed, the OASIS audit and signature comes into play. You can now sign and submit the OASIS at the point of care once these have been completed. It's as simple as clicking on each individual error, and it will take you to the part of the OASIS that you missed or is inconsistent with the assessment. Simply answer the questions, and as you click the forward arrow at the bottom, you will notice that our errors are decreasing. So I'm going to answer these questions and submit them. Click the forward arrow, and we're going to complete this last error. And if you'll notice, we're now at the screen where we can either save and sign or we can run the OASIS scrubber. You can save, sign, and submit from this screen at the point of care, which is something that is very new and functions extremely well for Axxess. We're going to save and exit. The fourth thing is the communication templates. So if we're back at our first screen, we're going to dive into the patient chart. And under the bottom left-hand corner, you will see a tab that says Communications. We're going to click on Communications. And in the top right-hand corner, we're going to click the plus sign. That means we want to add a new communication node. In the middle of the screen, you'll see a blue tab that says Description and select Template. If I click this drop-down menu, I'm going to see all of the templates that have been pre-populated into the system for a communication note. Now, these have been pre-populated by Axxess and also by your specific organization. Just for today's video, we're going to populate Alzheimer's disease goals. If you'll notice, now that I've selected a template, the writing for the template that it was created is now in my description box. Those are the features on the Home Health app. Now we are going to look at the Axxess Care app. The two features that we have to look at today deal with the clinician profile and the clinician searching visits. So under the hamburger menu on the top left-hand menu, under profile, if you will click edit, it brings us to a drop-down menu of multiple options. Under credentials, under certifications, you will notice that we have a driver's license certification here now. You would upload the front and back of your driver's license if you so chose to do so, or if an organization that you are working for has requested that. You would simply select Add Certification and tap to choose what type of certification. We're going to do driver's license. You would simply enter the expiration date and add a photo of the front and back, and then click Save. And then your driver's license would be added to your clinician profile for the agency to download for their records. This is not a mandatory upload at this time. So this is strictly for your profile as a personal preference. It's just certain accrediting agencies such as Joint Commission and CHAP and other states have a requirement for a driver's license upload. So this is now part of the Axxess Care features. We cancel this and we go here and back to our hamburger menu to home. We are going to go to visits and we're going to look at scheduled visits. Now, the other feature that we discussed was the search visits bar, which is located right here where you can see the cursor blinking. At this point, the clinician can search visits by whatever they're looking for. They can search by type of visit, they can search by location, they can search by a particular agency. If you're not sure what you want to search for, if you click the green question mark, this right here will tell you exactly what you can search for and all of the filters that are applied to that particular search. And you can search by any of those filters located in that question mark box. And we're going to discuss some upcoming mobile features. The upcoming mobile features for Axxess Home Health include the infection log and the incident log. The infection log allows at the point of care for documentation as well as the ability to save follow-up and documentation and tracking. The incident log allows for improved accuracy and compliance with incident reporting. These are important for any agency's QAPI program. For Access Care, the new features coming up on the clinician onboarding updates are offline documentation and the onboarding updates. For the clinician onboarding, this is going to allow streamlining the onboarding process with automation to pre-fill some areas while condensing the application process. The offline documentation is going to give the clinicians the ability to download visits while online so that you can document your visits in areas without service. Once service is reestablished, then the visits will automatically upload. There are three main areas where you can go for support and resources. Those are the Help Center, the Axxess user community, and live support. You'll notice that all websites are listed here for you for whichever you're more comfortable with, as well as direct phone numbers for Axxess Home Health Support and Axxess Care Support. We're really about empowering care anytime, anywhere. Thank you for the opportunity to introduce our mobile features and go over the Axxess Home Health and Axxess Care mobile apps.